Hi, my name is Trish Stewart, and on today's episode of 60 Minutes, we will be talking about tuberculosis. And what better a place to do it at than Cape Cod Senior Residences, an old tuberculosis hospital. This facility used to be an old tuberculosis sanitarium where they cared for and isolated people with TB. Antibiotics helped the country's epidemic after World War II. And a fun fact for you, John F. Kennedy Jr., his wife, and her sister's autopsies were all done in this building. And here are some pictures of the medical and administrative staff from back then. Some of the current staff members say they can even hear and see ghosts from the old TB hospital. Hello again, and welcome back to 60 Minutes with Trish Stewart. Unfortunately, my interviewer could not make it today, so I will be asking the questions as well as answering the questions. So here we go. We are talking about tuberculosis today. To start out, TB is a global pandemic, which means it is an outbreak across the world. It is currently still a pandemic, and it is found in every single country in the world. And it is one of the leading infectious causes of death worldwide. And the World Health Organization, or WHO, estimates that about 1.8 billion people are infected with the bacteria, which is close to about a quarter of the world's population. So the first question we have today is, what is TB or tuberculosis? So it is caused by a bacterium called Mycobacterium tuberculosis, and this bacterium attacks the lungs, but it can also attack other parts of the body, such as the kidneys, spine, and brain. But those cases are rare. It usually does occur in the lungs. And there are two TB-related conditions. One is latent TB infection, or LTBI, or TB disease. So first we'll talk about LTBI. In this infection, it can live in the body without making you sick. There are no symptoms. You don't feel sick. You can't spread the bacteria. It is not contagious. But to find out if you do have latent TB, a positive skin reaction test will show up, or a positive TB blood test will show up. And people with latent TB may never even have TB disease. The bacteria just may remain inactive for a lifetime inside their body. But people who do have a weakened immune system, or have any autoimmune disease, the bacteria will most likely become active and will cause the disease in the body. And even over time, if someone does have latent TB and it goes untreated, maybe in the future, years down the line, it can also become TB disease if their immune system becomes compromised in any way, or if they have any autoimmune diseases that end up showing up, that bacteria could become active and develop TB disease. So like I said, latent TB, no symptoms, you don't feel sick. The only indicator is that skin tests and blood results do show up positive, but chest x-rays and sputum smears show normal. And treatment for latent TB infection is to prevent TB disease. So now we get to TB disease, which is when the bacteria becomes active if the immune system can't stop the bacteria from growing. So that means they're multiplying in the body, the bacteria is becoming active, it's easily spreadable, and these people are actively sick and can spread the disease. So some symptoms, it can depend on where the TB is active in the body. Normally it's the lungs, and that's what most healthcare professionals deal with, is pulmonary TB, although it can spread to the kidneys and the spine or the brain. But symptoms for pulmonary TB include a bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood or sputum, weakness, fatigue, weight loss, no appetite, chills, fever, sweating at night. And the symptoms also depend on where in the body it is, but like I said, it usually happens in the lung. Also for TB disease, skin tests and blood test results also show positive, the same with latent TB, but the x-rays and the sputum smears will also show positive. The chest x-ray may look a little abnormal, and that's when you know it's TB disease rather than latent TB infection. So the next question, how is TB spread? So it is an airborne disease, which means it is spread through air from one person to another person. So when a person with TB disease of the lungs coughs, talks, sings, anything really that comes out of the mouth, TB bacteria can get into the air, and people who are around them can easily breathe this bacteria in and may become infected. So when these people breathe it in, it can settle in the lungs, it can begin to grow, and this bacteria can also travel through the bloodstream to other parts of the body. But when it does this, like I said, it cannot become infectious if it's in other parts of the body, just if it lands in the lungs. So TB in the lungs and throat can be infectious since it is an airborne disease. But I'd like to tell you that TB is not spread by shaking hands, sharing drinks, touching toilet seats, or kissing, like some might think, because it is an airborne disease. So the next question is, what are the risk factors of getting TB? Some people develop TB as soon as they become infected with the bacteria before their immune system can catch it. Other people may get sick years later, like I mentioned, and about 5 to 10% of infected people who do not receive treatment for latent TB will eventually develop TB disease at some point. So some people who are at high risk for developing TB disease are people who have been recently infected with the bacteria, obviously. Babies and young children, they have weak immune systems. The elderly, they are at high risk. People with medical conditions that weaken the immune system are also at high risk, such as people with HIV infection, that's a big one, substance abuse problems, diabetes mellitus, severe kidney disease, people with organ transplants, and the list goes on. Anyone with a weakened immune system is at high risk. And in recent years, people who have been infected with TB bacteria, the studies show that these people are either close contacts of a person with the infectious disease, people who have immigrated from areas of the world with high rates of TB, children less than 5 years of age, groups with high rates of TB transmission, such as homeless people or injection drug users or people with HIV, like I said. And also people in healthcare who work or reside with people who are either at risk for TB or do have TB. So these are all people with high risk. Next question is, how do you test for TB? There are two kinds of tests to detect the bacteria in the body. These tests can detect bacteria, but it cannot tell between latent TB or TB disease. The chest x-ray and the sputum smear are what's going to tell you the difference between latent TB and TB disease. But the skin test, it's called the Tuberculin skin test, or the TST, and it requires 2 visits to the healthcare provider or doctor's office. So the first visit, you get an injection of small fluid in your lower arm here. It's called tuberculin, the fluid. And then the second visit is for, you have to go about 48 to 72 hours later and have a trained healthcare professional look for a reaction on the arm. And if it looks normal, if there's nothing there, negative. But a positive results usually look like a firm red bump, and usually the provider will measure the bump and then from there provide you with treatment and further care. And this test is actually the preferred test for children under the age of 5. So the TB blood test is called interferon gamma release assays, or IGRAs, and there are 2 TB blood tests that are approved by the FDA, and these are called the QFT Plus and the T-Spot TB test. Those are both FDA approved blood tests. So the next question is, who should be tested? Not everyone has to be tested for TB, but the people who should be are people who have spent time with someone who has TB, people from a country where TB is common, usually in Latin America, the Caribbean, Africa, Asia, Eastern Europe, Russia, those types of places. People who work in high-risk settings, like I said, anyone who's around TB, or anyone who is at risk. If you work with someone who might be at risk, you should also get tested or screened. And infants, children, and adolescents who are exposed to adults who are at high risk should also be tested. And the treatment for TB, that's the next question. People with latent TB can't spread bacteria to others, but they should still get treated because they don't want to risk spreading it to other people or getting TB disease themselves. In the US, about 13 million people may have latent TB, and then without treatment, about 1 in 10 people with latent TB will get sick with TB disease. People may be considered for treatment of LTBI, the latent TB, if they have a positive blood result, or if their test on their arm is about 15 millimeters or larger. And there are about 4 CDC recommended treatment regimens for latent TB infection that use different drug or antibiotics, which are INH, RPT, and RAF. So healthcare providers should prescribe the more convenient regimen to the patient, or a shorter regimen when possible for the latent disease or infection. And the National Tuberculosis Controllers Association, or NCTA, recommend a short course, about a 3 to 4 month for latent TB infection treatment. But on the other hand, for TB disease, there are several treatment regimens, just like for latent, but these can take about up to 4, 6, or 9 months, depending on the regimen. Healthcare providers, like I said, they choose an appropriate regimen based on the drug susceptibility results, medical conditions, and allergies of the patient. And the most common antibiotics are rifampin, pyrazine, pyrazinamine, ethambutol, or streptomycin. All right, so the next question we have is, how do you prevent tuberculosis? So before anything, you want to seek medical treatment if you have symptoms like a prolonged cough, a fever, unexplained weight loss, as early treatment for TB can help stop the spread of disease and also prevent you from getting TB disease if you just have latent. Also, if you're at increased risk, such as if you have the weak immune system, if you have HIV, definitely get screened and tested as soon as you can. If you are prescribed treatment to TB, complete the full course. Don't just stop in the middle of the antibiotics, because a lot of times you still can get the disease and the antibiotics don't work. And if you do have TB, and even if you don't, always practice good hygiene when coughing. Avoid contact with coughing, covering your mouth and your nose when coughing, sneezing, disposing of sputum, and use tissues properly. Wash your hands. all types of preventative measures. There also is a vaccine for TB, but it's not widely used in the United States. It's called Bacille, Calmette, Guerin, or BCG. It's given to infants and small children in other countries where TB is more prevalent, or to people who are continuously exposed. And it is considered for healthcare workers only if they are, like I said, continuously exposed to TB, but the vaccine is not widely used in the United States. So the next question is, how did TB come about? And it is believed to go all the way back to the Egyptians, but there's no written evidence. The only written evidence was from about 9,000 years ago in Atlat Yam, which is a city that's now under the Mediterranean Sea. There were archaeologists found TB in remains of a mother and child that are buried together. So that's kind of when it was dated back to in written mentions. Throughout the 1600s and the 1800s in Europe, TB caused about 25% of all deaths. And a big date for TB was on March 24th, 1882. And on this date is when Dr. Robert Koch announced the discovery of the mycobacterium tuberculosis, which is the bacteria that causes TB. During this time, TB killed 1 out of every 7 people living in the United States and in Europe, so this was a big discovery. It was the most important step towards the control and elimination of the disease, and about a century later, March 24th was actually designated World TB Day, which wasn't a day to celebrate TB, but a day to educate the public about the impact around the world that TB has. So for my next few questions, I'm going to just go over the answers briefly because a lot of the information will be in my most recent research paper. It's called Timeline Paper of Tuberculosis for Epidemiology for Jim Leone. So if you're more interested in some of these answers, I would definitely look at that article. But the questions are, who are the leading organizations or scientists that research TB? And the answer to that is the TBESC and the TBTC. They are 2 big organizations that research the epi behind TB and kind of the observational epi to research to improve the identification, diagnosis, prevention, and control of TB diseases. And they have done many, many studies. So definitely look at that in my research. So the last question we have here today is, how do we end the pandemic of TB? It takes a lot of time and money, and the goal of the United Nations Sustainable Development was to end the epidemic by 2030, and it is required $13 billion a year in the US is required to reach this goal for prevention, diagnosis, and treatment. So ending the pandemic of TB is not a one-man job. It's a dual approach of just maintaining and strengthening current TB control priorities as well as new efforts to identify and treat latent TB infection as well as TB disease. And that is all we have for today, folks. We didn't go the full 60 minutes, but I'm sure I've taken up a lot of your time already. So thank you very much for listening, and I hope that you are all more informed on tuberculosis. Thank you very much.